Shocking dangerous findings, about corona, the latest research, and developments. 1. Coronavirus is developing itself, a new strain that is more deadly to humans. 2. The incubation period for the coronavirus is longer than is believed. 3. Coronavirus in influenza season, a double threat that is more deadly. 4. The immunity period for the infected does not exceed 50 days. Researchers at the College of Life Sciences at Peking University and the Pasteur Institute in Shanghai revealed that the coronavirus, COVID-19, has evolved into two main types, known as L and S. The scientists said that the newer and more aggressive type L strain accounts for about 70% of the cases analyzed, while the remaining infections are type S. The L strain was the most common type in the early stages of the outbreak in Wuhan, the Chinese city where the disease first appeared. However, it has decreased since last January, the decline that researchers attributed to human intervention. According to what was published by the American Science Fox site. While the S disease strain continues to infect new patients, experts believe that the reason is due to being less severe, which means that people carry the virus for a longer period before symptoms appear and the need to go to hospital, which increases the risk of transmission from person to person. The researchers wrote in the American National Science Review magazine, "These results strongly support the urgent need for more immediate and comprehensive studies that combine genetic data, epidemiological data, and graph records of the clinical symptoms of patients with coronavirus disease COVID-19. Experts warned that the study that discovered the mutation only uses a tiny amount of data, 103 samples, so more research is needed, while another researcher added that it is normal for viruses to change when they are transmitted from animals to humans. According to what was published by the British Daily Mail site. Commenting on the research, Michael Skinner, lecturer in virology at Imperial College London, said it was too early to speculate on any practical results based on what he called an important observation. He added that at present, there is no sign that it will affect vaccination strategies against the disease. Number 2. The incubation period for the coronavirus is longer than is believed. The incubation period for the new mutated coronavirus, which has killed more than 900 people in China, is up to 24 days, according to a new article co-written by Chinese epidemiologist Zhou Nanshan. Chung, who is famous for his efforts in dealing with the outbreak of severe acute respiratory syndrome, SARS, in 2003 and was appointed as a senior advisor in the current corona crisis, wrote that the incubation period may be so short that it does not last for 1 day or be longer than 24 days, which increases 10 days later than previously thought. Number 3, coronavirus in influenza season, a double threat that is more deadly. What can happen when infected with the emerging coronavirus and seasonal flu at the same time? A question that begins to pose itself with the approach of autumn, which marks the beginning of the flu season. How dangerous is the meeting of the two viruses? Many questions loom on the horizon about the coronavirus, which continues to threaten the stability of the world, especially with the approaching influenza season, as experts study the extent of the seriousness of the coronavirus during the influenza season that is approaching. With a flu wave expected soon, researchers around the world are now interested in the question of what can happen when a person becomes infected with the coronavirus and influenza together, according to what was published by the American, NPR, website. Dozens of cases have been recorded with corona and influenza together, and according to Michael Math, a professor of medicine at the University of California, San Francisco, it is possible for the two viruses to infect the patient at the same time or in succession, that is, to be infected with influenza, for example, and in the following month with the coronavirus. Mathvi indicated that both viruses can cause serious inflammation in the lungs, which would pose a threat to the respiratory system and make breathing difficult. One study examined people who had tested positive for the emerging coronavirus and found that about 20% had tested positive for at least one respiratory virus, which can be dangerous in infants and the elderly in particular. While some previous research indicates that viruses can have complex interactions when infection with the two viruses is present. This may lead to more serious complications, or the effect may be preventive in the short term. The seasonal flu vaccination may protect people from double infection with influenza and COVID-19 and reduce the total number of flu cases, which should help the healthcare system deal with respiratory diseases. According to what was published by the American Forbes website, experts stressed the need to adhere to social distancing, wear protective masks, and follow all preventive measures to avoid catching seasonal influenza or the emerging coronavirus. Number 4, the immunity period for the infected does not exceed 50 days. A study of a sample of 30,000 people proved that the strong antibodies equivalent to SARS-CoV-2 infection lasted for several months, extending to only 5 months. Thank you for watching the video. Research resources are included in the description for the video.